There you go. It's
All
yours.
right. Thank you so much, Virginia. That was a great presentation. Thank you. And hi, everybody. I'll just start off by sharing my screen. There we go. Okay. So hello, everybody, and welcome. I'd like to start by thanking Caridad for this wonderful opportunity that you've given all of us. It has been an amazing day of listening to all these wonderful women that are supporting all these other women as well, and it's so wonderful for all of us to be together and to share so much knowledge, and I know that a lot of people who have attended have learned a lot from it. I'll just start off by telling you a little bit about myself. My name is Sabah. I am a certified doula and a hypnobirthing instructor. I'm certified by Dono International, which is one of the largest certifying and doula training organizations. I also teach the WISE Hypnobirthing program for hypnobirthing. I was born and raised in the UAE, and I have Pakistani and Yemeni roots. I actually used to work as a professional photographer before I became a mum of two, and that changed things completely. Once I became a mum and I was introduced to the whole world of pregnancy and birth, I just knew that this was my calling, becoming a doula. My husband would find me well after I'd had my babies, watching these graphic videos on YouTube, graphic to others. To me, they were beautiful. I'd be sitting there crying and he'd just think, you know, wow, that's very strange. But when I knew about, when the opportunity of training as a doula came to me, I just knew that this was exactly what I wanted to do. And I have had the great honor of witnessing some beautiful births over here in Dubai. I also run my business that's called Empowered Birthing DXB. Now, just to tell you a little bit about my business, it is based on three main important fundamentals, and that is to educate, to support, and to empower. These are three very, very important things to me for every couple that comes to me for support, because quite honestly, when I was having my babies, I didn't have any of these things. I mean, bless my husband, I had him for support. I didn't feel empowered, nor did I have enough education. So what drives me every day is these three words, and to make sure that every couple that comes to me goes into their birth with confidence and with positivity. Now, the topic from my presentation today was hypnobirthing and birth support, but since we are coming towards the end of the day, and I know that a lot of you have gained a lot of knowledge, which is really, really helpful, I thought I'd change things up a little bit and make things a little bit interactive and start off with a birth trivia quiz. So for the next half an hour, I'm going to quiz you on all the knowledge that you've gained today. All right? So now this quiz is made up of 20 questions. We've got 5 categories that we're starting with. I will pause for about 10 seconds for you to write your answer. We are very limited with time, so it might be a little bit less than that. You can write your answer on a piece of paper, on a whiteboard, or in the chat function on Zoom, whatever you like. Please don't Google your answers. I will be checking. I know the cameras are off, but I might be able to tell. And most importantly, let's just have some fun. All right, now the first category is birth preparation. And the question that we'll start with is, when is a baby considered full term? Feel free to pop your answers in the chat function. Is it A, 37 weeks, B, 38 weeks, C, 39 weeks, or D, 40 weeks? Now, there is a little bit of confusion here. Obviously, ACOG, which is the American College of Obstetrics and Gynecology, they have recently changed the guidelines about that. So the answer actually is C. It used to be 37 weeks before, but now you are considered full term if you are at 39 weeks. Next question, when should you give your birth preferences, also known as birth plan, to your midwife? Is it A, at 30 weeks of pregnancy? Is it B, on my due date? Is it C, after your hospital tour? Or is it D, when I'm in labor and I get to the hospital? I know a lot of women do like to come up with their birth preferences, but perhaps they might not be too sure as to when they should hand it over. Now, the correct answer is D, when you are in labor and you get to the hospital. Now, please bear in mind, our midwives are working really hard to support so many women, so you want to keep it short and sweet. 1 A4 size page, bullet points, and one doula tip I can give you is to have lots of copies. So give one to your doula, to your midwife, and have one on the door as well, so that whoever's walking into your labor room can have a quick glance and see what your birth preferences are. Next question, which of these should you pack in your hospital bag? Is it A, straws, B, a mirror, C, LED candles, or D, all of the above? What do you think? Now, there's a lot of things that you need to pack, and these might seem a little bit unusual, but these are things that doulas definitely have in their bags. And the answer actually is all of the above. A straw comes really handy when mum's in a bit of an awkward position and they want to stay hydrated rather than drink from a cup. You've got a straw there so they can have access to water all the time. A mirror is really handy because sometimes I do have mums who say, I don't really want to see the baby when, you know, when it's crowning and stuff. I don't want to see anything. But at the very last minute, they do change their mind and say, I want to see. So a mirror is really great because then they don't miss that amazing moment of seeing their baby's head come out. And LED candles, well, you know, you can guess why that's really helpful because they create such a beautiful ambience around the mum. But then again, we can't have real candles because we're in a room full of oxygen. So LED candles are the way to go. Next question, true or false? I don't need hypnobirthing if I'm having a cesarean. Now, there have been quite a few wonderful hypnobirthing presentations, and I'm sure that by now you do have an idea about this answer, but I will share the answer with you anyway now. The answer, in fact, is false, because you do need hypnobirthing. It's not just for a vaginal birth, it's not for an induction or epidural, it's for all kinds of birth. And especially when you're in a cesarean, it's quite overwhelming in that operating room. You've got people walking around, you've got tools moving around everywhere. So hypnobirthing is a great tool to have to really bring yourself to that relaxed state, to have a really nice and positive experience out of everything. Next question. Before giving birth, how do you stop someone from sharing their negative birth story? Now, this is something I teach my hypnobirthing clients. Do you say, stop? Do you say, tell me everything, I need to be ready? Do you say, let's swap birth stories after I've given birth? Or do you just walk away? Now, I know that different answers might appeal to different people, but based on what I teach, there's one particular answer that I do tell my couples to do, because as much as you're trying so hard to remain in a positive frame of mind about your birth, there are some negative influences around you. So in order to stop that, but also not really offend anyone, be diplomatic, the answer is C. Let's swap birth stories after I have given birth. It's a nice way of saying, please don't tell me anything. All right, how are we doing so far? Are we ready for the second category? This one is labor and birth. Now, which of these is the perfect birth? Now you've seen, I'm sure that you know the answer to this question. Is it A, this cesarean? Is it B, this lovely water birth? Is it C, this lady who's relaxing with her epidural? Or is it D, all of them? Lots of different ways to give birth. And unfortunately, a lot of women have this concept that, oh, if I get an epidural, I didn't exactly get my perfect birth, or oh, cesarean, didn't get that perfect birth that I wanted. But in fact, the answer is D, all of them, because the perfect birth is what was right for you on that day. And I know that this has been said several times by all our lovely presenters. The perfect birth, or the positive birth experience, as we call it, it's a state of mind. It's when you come out of your birth feeling like, yeah, things didn't necessarily go the way I had expected them to, but I made all the choices I wanted to make. I was positive, I was calm, in control at all times. That's the perfect birth for you on that day. Right, next question. What does a UFO have to do with giving birth? A, is it that studies have shown that aliens give birth like humans do? Is it B, that UFO stands for unobtrusive flashing object? That's quite a mouthful, isn't it? Is it C, that the UFO stands for upright, forward, and open? Or is it D, none of the above? Now, some women might want unobtrusive flashing objects in their labor room, so it could be that answer. What do you think? Let's find out. The answer, in fact, is C. UFO stands for upright, forward, and open. Now, have a look at this lady here. She's upright, she's leaning forward, and her legs are apart, so she is open. By being in this position, which is what we encourage a lot of our clients to be in during labor, you open up your pelvis by 30%. And research shows that you are 23% less likely to need any kind of medical assistance. So please remember, UFO, be upright, be leaning forward, and open up your pelvis to allow that baby to descend and to make enough space. Now, I know that this particular laboring position might not be something that you want to be in all the time. So here's another reference for you. All lovely positions where mum is leaning forward, upright, and she is open as well. Feel free to screenshot this if you'd like to keep it for a reference. Okay. Next question, true or false? You should never ask a labouring woman if she is struggling. Now this one's for the birth partners. Sometimes you do feel a bit concerned, you're not really sure, should I say something, should I not? You know, is she okay? I'm not really sure. But the answer in fact is true. You shouldn't really be asking a labouring woman if she's struggling. A lot of the times you'll see us as doulas as well. If we can see that mum's doing absolutely fine, she's relaxed, in control, we just hands off and we sit back and hold the space for her. You don't have to bring her attention to any kind of distraction. She might look like she's struggling, but a labouring woman will always tell you if things are not okay. All right, so you don't need to necessarily ask her too many times, you know, are you struggling? Is this okay or not? You know, if she's not happy with something, she will let you know. Right, next question. If your membranes rupture, what do you do? Membranes rupturing, in other words, a lot of people recognize that term as waters breaking. So what exactly is it that you should do? Do you drop everything and run to the nearest hospital or your hospital that you've chosen? Do you call your doctor or your midwife? Do you put a tampon in to stop the leaking? Or do you have a membrane rupture party? Hooray, the baby's coming. Lots of different answers there, lots of different options that you can do, and some might be influenced by the things that we see in movies. But in fact, the answer is B. Call your doctor or your midwife. I wouldn't advise you to just drop everything, run to the nearest hospital. I wouldn't advise you to put a tampon in because that does increase the risk of infection, but you can put a pad in to be a little bit more comfortable, and maybe save the party for a little bit later. But when you do call your doctor or your midwife, do remember your coat. So the color, the odor, the amount of fluid, and the time when it's happened. So all of these things are what you're going to tell your midwife or your doctor so that they can advise you accordingly as to what the next step is. Okay, getting to the third category now. How's everybody doing? Is anybody cheating? Anybody looking for Google? Are we all being very honest with our answers? All right, let's start with the third category, which is now babies born. So after birth. When should you do skin to skin? Should you do it as soon as your baby's born? Do you do it after your baby has been weighed? Do you do it after your baby's had their first bath? Or do you do it when you come home from the hospital? Now, I've got a picture here of a dad who's doing a bit of skin to skin because I wanted to remind you that fathers can do skin to skin as well. You see a lot of images of mums doing skin to skin, but dads, you can do it too and enjoy that lovely moment of bonding with your baby and enjoying. So do you do it as soon as your baby's born or later on? Do you wait until you've come home from the hospital? The answer is as soon as your baby is born. So you want to just as soon as the baby comes out, straight onto your skin, because those precious moments are not going to come back. So really, really enjoy those. Okay, next question is true or false? Your baby must wear a hat immediately after birth. Now, I can guarantee that pretty much all of us who are attending this birth symposium today did have a hat on when we were born, but research is starting to change now. And according to the British Medical Journal, there was an article that was actually published in 2008 that kind of confirmed whether or not a baby should be wearing a hat immediately after birth. So the answer actually is false, because it isn't true that your baby loses all of their heat from their head. And if you're doing skin to skin, your body temperature is regulating your baby's body temperature. So as long as the baby's on your chest, touching your skin, you've got a sheet on you. What also happens is baby's head releases a lot of pheromones, and a lot of that lovely baby smell that we all love goes to the mum, and like the hormones that we talked about, the oxytocin, love hormone starts flowing, and that helps with, you know, you producing milk, with recovering after in the postpartum period, and the placenta coming out. There's so many reasons, and these are medically researched things that people have actually researched these and seen how much it benefits to have skin to skin and to have a baby without a hat on. So please don't put hats on babies. Okay, last question of this category is true or false. Your baby must be fed immediately after birth. Now, there's a lot of mums who worry about this because immediately it's like, oh, you know, pulling on the breast and, oh, come on, put it in the baby's mouth, let's go. The baby needs to feed right away, this and that. But in fact, as doulas, we say no. Babies don't need to be fed immediately. Some babies might be born and kind of fancy a little bit of breast milk right away, but majority of the babies, when they are born, they are not starving. So enjoy those moments of that lovely skin to skin bond with your baby. And when baby starts to show some signs of wanting to feed, then you can start breastfeeding. But please don't stress about feeding your baby right away. Right, that's it, we're done with the birth, on with the breastfeeding. It doesn't have to be that way. So enjoy those precious moments. Okay, almost coming to the end. Is everybody still with me? We're in the fourth category now, very, very close. Let's talk about breastfeeding. You guessed it from that photo. So, how often should you breastfeed your newborn baby? Do you do it every hour? Do you do it every 2 hours? Or, as my doctor told me, should I do it every 3 hours? Or should I do it whenever my baby's hungry? Every 3 hours is a very common advice that mums are given. Please feed your baby every 3 hours. Some even say every 2 hours, but in fact, the truth is you should feed your newborn baby whenever they are hungry. So when we say on-demand feeding, that's what it means. So if your baby's hungry, go ahead and feed your baby. You don't have to wait for a certain time for it to happen between your feeds. Next question, how long does breast milk last in the fridge? A, is it 1 hour? Is it 6 hours? Is it 6 days? Or should breast milk actually never be placed in the fridge? What are your thoughts? Again, different options, lots of different, people might not be quite aware of how to store breast milk, but the answer is in fact 6 days. And how you can remember that is with the 666 rule. So always remember, when you want to store your breast milk, 6 hours at room temperature, 6 days in the fridge, 6 months in the freezer. But bear in mind that if you're living in a hot climate, that could come down from 6 hours to 4 hours, for example. So this is just a general guideline for you to know that this is how you can store your breast milk. Right, true or false? If your breasts aren't full immediately after birth, you don't have enough milk. This is something that a lot of my mums that I see for breastfeeding support, they kind of go like, oh, why didn't it happen right away? What's going on? And they tend to kind of go into this cycle of thinking, oh my gosh, maybe I don't have enough milk, what's going on? And all this confusion that comes in. But in fact, the truth is that it's false. Your breasts don't necessarily have to fill up right after birth. Remember that liquid gold that you're producing called colostrum, that's what baby needs. And that's literally just a teaspoonful that your baby requires at that time. So in the first few days, you don't necessarily, what I mean to say in the immediate postpartum period, after you've given birth, you don't necessarily have to expect your breast to fill up right away. Some women do, but if you don't, that's okay. Give your breast a few days to adjust to the supply for your baby, and then you can, you will notice the milk come in. True or false, you should only breastfeed for 10 minutes per breast. Now, again, this was some I've seen this a lot with mums who sit there breastfeeding with a clock in front of them, and the very, very first thing that I do, and I'm sure that you all know the answer as well, is no, you need to get rid of that clock. Different babies, different breasts, different flows, and different ability to suck the breast milk. So please don't follow any time initially in the first few days, in the first few months. You just need to follow your baby's cues. So your friend's baby might feed within 5 minutes, but your baby takes 10 minutes. That's absolutely fine. If your baby's happy, if your baby's gained weight and hydrated, enough wet nappies during the day, that's all you need to know. So please don't time and worry about, oh, 10 minutes here, 10 minutes there, 15, oh, I've lost count. Please don't stress too much. Just follow your baby's cues. Okay, final category now. We're right towards the end of our quiz now. So the last category, can you guess what it is based on the image that you can see? It is in fact doula support. So let's get started. True or false? Doulas are a new trend. Oh, this is something that I'm sure that a lot of doulas go around telling people what the truth is. Are we a new trend? Is this something that we do in like the 2020 onwards, or have we always been around? The answer, in fact, is we're not a new trend. Doulas have been around for centuries. And if you ask your mothers, your grandmothers, they all had doulas. Not necessarily how they are now. We are professionally trained doulas, but their family members were all of their doulas. And that's essentially it. We're there for you, to serve you, to support you, to look after you. And that's what doulas do. So we've always been around. And thankfully, we're making a comeback now. All right, what happens if my doula can't make it to the birth? So do you have to go on without her? B, do you call a close friend who can step in instead? C, does that mean you will be supported by a postpartum doula? Or D, will you be supported by your backup doula? A lot of mums tend to kind of worry because life happens, doesn't it? Sometimes you end up with food poisoning, sometimes your children are sick, or your car battery has died. It could be absolutely anything at all that could stop you from actually attending a birth. And it is a cause for concern because you're kind of hoping that your doula is going to be there. So you will not be supported by a postpartum doula. You will actually have a backup doula. So when you meet with a doula and you've gone through everything that you need to do, you will also be introduced to a backup doula who's on standby in case your primary doula can't make it. Then your backup doula can step in and knows all the things about your birth preferences and everything like that. Can I ask my doula not to touch me, or not to talk to me, or not to give me privacy? A, is it no, that's going to upset her? Is it B? No, she has to do her job, so she has to touch you and talk to you. Is it C? Because she's there to give you what you want. Or is it D? Yes, you can say that, but maybe you want to clear the air a little bit later and make sure that she wasn't upset. Now, this is a cause for concern for some mums because, you know, at the end of the day, they don't want to upset anybody, but the most important thing for you to remember, the answer is C. Your doula is there to give you whatever you want. If you need privacy, you need a few moments alone, your doula will happily step out. If you want your doula not to touch you or to just be a little bit quiet so that, you know, you can focus on yourself, that's absolutely fine. It's so important for you to find a doula that you feel so comfortable with that you can say anything to her and you know that she won't be upset either. And that's why it's important for you to know that as doulas, when we come into the room to support you, we leave everything behind. We're not upset with anything. We're not going to be offended by anything. We don't bring our beliefs and our views. We're just there for you. Whatever you like, whatever you need, that's what we're there for. All right, true or false? My doula can check my dilation and give me an epidural. Now, this is really, really important for you to know because sometimes people are not really sure. So if I've got a doula, I've got a midwife, what can one do that the other can't? The important thing for you to know is that is false because checking your dilation, giving you an epidural, these things come under clinical tasks or medical tasks, which we are not trained to do. So these are things that your midwife or your doctor will do. So doulas are there to give you three things: emotional support, informational support, and physical support. So it's really, really important for you to know what the difference is between those two. With that, we come to the end of our quiz. Thank you so much for participating. I hope that you enjoyed it. I hope that you learned something from it. And just before I leave you, if there's anything that you would like to know more of, you can follow me on my Instagram. That's at empoweredbirthingdxb. You can also visit my website, which is empoweredbirthingdxb.com. That's got all the information that you need about what I can offer you, my packages, and all the latest things that Empowered Birthing DXB is coming up with. I've also got my Real Talk starting next week, so please do stay tuned on my Instagram. That's where I'm going to announce it. I've had several episodes since September onwards for Real Talk, and we've covered so many topics. We've had experts that come on the panel, talk about lots of different things, question answer sessions, and it's been really, really great. So we took a little short break during the winter break, so we're back now, so please stay tuned for that. We've got very interesting topics lined up. And of course, if you need to email me, you can email me on Sabah at empoweredbirthingdxb.com. Any questions you have, any inquiries that you might have, please feel free to ask me. I'd be more than happy to support you. So thank you so much. I hope you enjoyed the quiz. I'll stop sharing my screen now. And thank you very much.
Thank you so much. So tell us a little bit about yourself. You're currently in Dubai.
I am, yes. I'm based in Dubai and I offer doula support. I also do hypnobirthing classes. I can do them privately. I actually do them around the world as well. So I've recently taught a mum in Australia all the way there, and it was really, really lovely to teach her hypnobirthing. I'm also part of the More Than Birth Doula Collective, which Anna Pierre is also a part of. So she's my wonderful colleague. And yeah, it's been absolutely great to be able to do this and support so many mums.
That's awesome. Thank you so much for being here, and everybody enjoyed the quiz. It was a good way to wake up after 8 hours of knowledge.
Thank you.
Thank you again, and we'll be seeing you soon.
Thank you. Thank you
again. So if anybody needs to remember the information, birthsymposium.com, the links are all there for everything. Okay, thank you again. See you soon.
Thank you. It was so much fun.
Yeah, sorry, after 8 hours, I've kind of lost my words. Somebody else.
No, I noticed.
I was like, wait a minute, I forgot.
Wait, get coffee quick.
I know. Thank you again.
Yeah, everybody loved it. It was so interactive.
Oh, thank you so much. I figured it'd be good to kind of wake everyone up and test them and see, are you listening to what we're talking about?
There's lots of comments, so check the chat.
Oh, yes, yes. See lots of answers. That's good to know.
Yeah.
I don't know if you want to check the chat now. Let's see. Any questions? I already follow you, Sabah, and you're full of knowledge a pregnant lady needs. Awesome. Love the quiz. So informative in a fun and interactive way. Super. We'll follow you for sure. False DCC. Okay, I think that's good. Oh, and I loved your session.
There's lots of C's and A's and D's.
My daughter walked by and was like, what does B mean? Is it like a code? I was like, no, it's an answer to a question. I was sending you a special message. Yeah. Okay, thanks again. Let me stop this recording.